Knee joint innervation is divided into two components.
Anterior knee innervations, derived from the lumbar plexus through its major branches. Posterior knee innervations, derived from the sacral plexus through its major branches. Before supplying the knee joint, these nerves form three different plexuses: subsartorial plexus, lying on the medial aspect supplying anteromedial knee and anterior joint capsule; peripatellar plexus, lying anteriorly supplying skin around the patella and anterior joint capsule; popliteal plexus, lying posteriorly, supplying all intra-articular structures in posterior capsule. The dermatomal and osteotomal innervation comes from the branches of the lumbar plexus anteriorly and the sacral plexus posteriorly. Notably, the anterior capsule of the knee joint is richly innervated compared to the posterior capsule by the articular or genicular branches that arise from the terminal branches of the plexuses. Proficiency in administering blocks that target all pertinent nerves supplying the knee joint relies heavily on a comprehensive understanding of two crucial anatomical landmarks within the thigh: femoral triangle and adductor canal, separated by the apex of the femoral triangle, which is the intersection point of the medial border of the sartorius and the medial border of the adductor longus muscles. The femoral triangle is a triangular subfascial space below the inguinal ligament, whereas the adductor canal is a musculo-aponeurotic tunnel encompassed by two muscles and one aponeurosis extending from the apex of the femoral triangle above to the adductor hiatus below. It is triangular in a cross-section, bounded anterolaterally by the vastus medialis muscle, posteromedially by the adductor longus muscle proximally and adductor magnus muscle distally, and medially by the vastoadductor membrane, a strong fibrous membrane joining the anterior and posterior walls. The nerve to vastus medialis lies outside the adductor canal above the VAM in a separate fascial sleeve. The subsartorial plexus lies in this region, sandwiched between sartorius and VAM. The femoral triangle is a conical subfascial space that continues into the musculo-aponeurotic tunnel, leading posteriorly to the diamond-shaped popliteal fossa.
This unique anatomical arrangement creates a visual impression of a funnel leading into a tunnel within the thigh. Therefore, the adductor canal serves as a passageway for structures that move between the front and the back of the thigh. The adductor canal consists of three foramina. The femoral vessels and the saphenous nerve enter the adductor canal through the superior foramen. The saphenous nerve and descending genicular vessels exit the adductor canal through the anterior foramen, piercing the VAM. Finally, the femoral vessels exit the adductor canal via the inferior foramen, also called the adductor hiatus, to become popliteal vessels. The nerve to vastus medialis lies outside the adductor canal above the VAM in a separate fascial sleeve. These diverse anatomical connections divide the adductor canal into the proximal, middle, and distal adductor canal.